Hello and welcome to Reimagining Love. I'm Dr. Alexandra Solomon. I have been studying relationships for over 20 years as a couples therapist, a professor, an award-winning author, and as a wife, mother, daughter, sister, and friend. Now, I'm inviting you into this space each week as I dig into some of the toughest and most fascinating relational dilemmas of our time. If you want to discover how to create vibrant and loving relationships in your own life, you have come to the right place. This is Reimagining Love. Hi there. Welcome back to Reimagining Love. So it's just you and me today for this week and next week for a two-parter that we've been wanting to do for a while now. We're calling this series, What to Do When Your Partner is Struggling. So here's the scenario that I'm imagining. Your partner that you've been with for a stretch of time, that you're committed to, that you're building a life with, that there's some degree of interdependence with, your partner is in a dark night of the soul of some kind, in a struggle of some kind. Maybe that is a job loss. Maybe they've just received a health diagnosis. Maybe they're dealing with a chronic health condition that kind of ebbs and flows, waxes and wanes. Maybe there's a mental health challenge, depression, anxiety, an eating disorder, maybe an addiction. Maybe your partner has just lost somebody in their orbit, which certainly affects you, but it is, like let's say it's primarily their person. So they're dealing with grief, or there's a family drama, or they've got this past ex where there's co-parenting challenges or something that gets carried with them into and through your relationship. So it's some scenario where your partner's bandwidth is being quite occupied by this struggle. Like if we took a pie chart of what's happening inside their head, inside their heart, what's occupying their energy, what's occupying their time, this struggle would be a big ass part of the pie chart. And time and attention for you would be a somewhat smaller part of the pie chart than it has been historically. So that's what we're going to explore here, what that's like for you, what that means for your relationship, and what does coping look like? How do you make sense of it for yourself? How do you show up for your partner? Where are the boundaries? Those are the questions that we're going to get into today. In the first part, we're going to be contextualizing this scenario and providing a lot of validation for the struggle that comes with having a struggling partner. We're going to talk about a framework called the Recursive Relational Framework, the RRF, that I coined many years ago. The short of it is that, number one, problems that live inside of your partner or that belong primarily to your partner have an impact on you. And number two, how you relate to your partner's problem actually impacts and shapes the course of the problem. We're also going to discuss factors that shape how your partner's struggle impacts you. Hard things are hard, right? Like that's just the way it is. Hard things are hard. But it's also the case that the particular ways that you are getting activated in the wake of your partner's struggle, that has a lot to do with your specific wounds, your specific history, the role that you played in your family of origin. And a reminder, if you are new around here in the Reimagining Love world, we created a really solid 7-episode series about family of origin roles. And we created a lovely free workbook, and you can find links to all those resources in the show notes. Okay, so as a disclaimer, as we get started here, having a partner who is struggling can lead you to question the viability of the relationship. That's real. That's understandable. That makes sense. And I want to be clear with you that in this series, we are not talking directly about how to decide when and if too much is too much. This series is about how to care for your partner, how to care for yourself when your partner is struggling. There are times when certain challenges make the relationship no longer viable. The decision to stay or go is shaped by your capacity, the history of the relationship, the quality of the relationship, the degree to which your partner is investing in their own well-being, even as they struggle, and on your partner's ability to recognize and validate the impact and strain that their struggle has on you. In other words, can their empathy be bigger than their shame or their defensiveness, at least some of the time? What I want you to know is that if you are carrying a question about should I stay or should I go, if you're carrying that question with you into this pair of episodes, I feel pretty confident that these conversations are going to offer you some insights and some strategies that will help you feel more clear about the risks and the benefits of this relationship. So, okay, the recursive relational framework. Here goes me getting to be nerdy again. Imagine in your brain 2 circles. One circle says the individual challenge, and the other circle says the relationship dynamics. And there's an arrow that goes from the individual challenge circle to the relationship dynamic circle. And there's another arrow that goes from the relationship dynamic circle to the individual challenge circle. Okay, that's the little picture I want you to have inside of your head. So that first arrow, the arrow that goes from the individual challenge circle to the relationship dynamic circle, that tells us that problems that live inside of your partner, problems that have to do with your partner's neck of the woods, affect you. They shape the dynamics of your relationship. If your partner has depression, the depression lives inside of your partner's body and has a profound impact on the dynamics between the two of you. Okay, fine. The second arrow that goes from relationship dynamics to individual diagnosis is a little bit of a trickier one. And it says that how the two of you relate to the individual challenge actually has the power to shape the course of the individual challenge itself. So the arrow goes in both directions. And listen, if we're going to tackle a topic as tricky as this, we got to be careful that none of this is about blame and none of this is about shame. This is about acknowledging and reckoning with the profound interdependence that happens when we commit to intimate partnership with somebody, right? Your partner's depression shapes the dynamics of your relationship and how you talk to and about your partner who's dealing with depression shapes the course of their depression. Both those things are true. So you may not need the data to back this up, but I do want to share some of the research about this because I think it really highlights and brings home this interconnectedness. So let's think about direction 1. Your partner's struggles affect you. There was research in 2024 that found that if you are an adult without depression, but you live in a household with somebody who does have depression, you likely earn about 11% less than folks in a home where there is no depression. You yourself are less likely to be employed. You are more likely to miss days of work, and you are likely to report lower quality of life. You don't have depression. Your partner has depression, but your income, your ability to work, that all is compromised as well. In 2021, there was some research in a journal called Medicina, where living with somebody who has bipolar disorder as a diagnosis shapes the couple dynamic. The non-affected partners report things like lots of self-sacrifice, some caregiver burden, some emotional impact, maybe their own health problems even. Those effects, by the way, are mitigated or lessened when the non-affected partner has information about bipolar disorder, when they have a good working relationship with the healthcare providers who are helping the person with the bipolar disorder, but they are overall more at risk of having negative impacts, also increased like dissatisfaction with the relationship itself. Okay, those are a couple of examples of mental health challenges. Well, it's also the same with chronic disease or physical health challenges. So here's what the research tells us there. When you live with a partner who has a physical health diagnosis, like cancer, like diabetes, like heart disease, like chronic pain, you yourself are at increased risk of reporting poor psychological well-being, lower relationship satisfaction, experiencing some amount of burden associated with the care. And you may report that over time, it becomes harder and harder to provide support to your partner. Okay, so this is, there's no blame. I'm going to say it probably 5 more times in this conversation. There's no blame. People don't ask for bipolar disorder. People don't ask for depression. People don't ask for a diagnosis of diabetes or cancer. And at the very same time, what I am validating is the impact on the partner is real. And it has been supported again and again and again over like 25 years of research. Let's look the other way. The arrow now that goes from the relationship dynamics to the person's diagnosis, okay? How the relationship dynamics shape the outcome and the course of the health diagnosis. One of the biggest areas here has been around substance use. And what has been found again and again is if I am struggling with a substance use disorder, for example, and I go to a rehab program, my risk of relapse is going to be reduced if my husband participates in my recovery program. If he's also doing his work, we oftentimes talk about addictions as family diseases. If he looks at his own patterns of codependence, of enabling, the ways in which he is shoring up his sense of okayness in a given day based on how I'm doing, his use of criticism, his frustration, his withdrawal, whatever he does in the face of my challenge has the power to shape the course of my recovery, even though I'm the one with the addiction. So that finding has been replicated over and over again, that poor family function is a potential trigger of relapse and substance dependence. And that by contrast, good social support plays a protective role. It reduces the chances of relapse. There's some research from way back in the 1990s that found that if you have a woman and she has this was research done with straight couples, and if the female partner in the straight couple had a diagnosis of depression, and if the couple reported some amount of relationship conflict, then couple therapy turned out to be a more effective treatment for her depression than individual therapy did. So what is that saying? It's really supporting that second arrow, isn't it? That if you work on the relationship dynamics, you are able to more deeply and positively affect the individual diagnosis, the depression itself. And there's similar research about anxiety disorders. If one partner has an anxiety disorder, how the other partner relates to it shapes the course of the anxiety disorder. So a partner who is very critical of their partner's anxiety and says, "You're exaggerating. This is too much. I'm exhausted. You're being a baby here." That reinforces and kind of cements in the anxiety symptoms. Similarly, the sort of like approach of, "Oh my gosh, you're anxious. Of course, we're not going to leave the house. Of course, we're going to just sit here all day under a bunch of blankets and watch TV. Of course, like everything is too big and everything is too much." So meeting that anxiety, in an effort to, I think people who are critical of their partner's anxiety are doing so in an effort to get them to kind of pick themselves up by the bootstraps. It's a very Western American approach, right? You just got to hunker down and no coddling around here and just get through it. That approach, not particularly effective. The other approach of really trying to like make your partner so super duper duper safe also comes from a loving place of trying to help your partner feel better. But it also reinforces the anxiety to say, "You're right, everything is too scary. We have to make our world very small." That reinforces the anxiety. And so what these researchers found is that the middle road is the best one. They call it like non-hostile criticism of saying, "Listen, I get it. You're anxious, but let's figure out how much you can do." rather than avoiding and rather than powering through. What's the sweet spot here? Can we go to the party for an hour? Can we go, but you and I kind of hang out together? Like, what's the kind of workaround that we can do? Can we go out? Can we just go for a 30-minute walk instead of leaving the house all day? And that middle ground approach has been found to help the person with the anxiety disorder. Like, that is a powerful part of a treatment plan. That's not the total treatment plan, but that's really helpful to somebody who has anxiety to be partnered with somebody who can use non-hostile criticism, who can be kind of a strong advocate for, we're not going to give in here and we're not going to push through. We're going to find something in between those extremes. And that puts a responsibility on the non-affected partner, right? The non-anxious partner, to figure out, how do I create the capacity inside of myself to be creative and patient and positive, right? That is a kind of emotional labor. Okay, so those examples were the impact of relationship dynamics on substance use and on a couple of mental health diagnoses. Before we leave this part of our conversation, let me just share with you that the very same kinds of findings show up when researchers look at health diagnoses and relationship dynamics. So, marital cohesion, like feeling like we are a team, that is linked to better prognosis for people who have hypertension. Marital cohesion is also predictive of a better rate of survival in congestive heart failure. Marital strain is associated with an increased risk of death and kidney disease. Marital strain puts women at greater risk of heart attack if they already have some brewing heart disease. Marital strain increases the risk of heart attack. Marital support, marital confiding, the ability to talk about what's going on, reduces the risk of death in women who have stage 2 and stage 3 breast cancer. Like, these are powerful findings. That cancer process is shaped, right? The journey that she's having through a cancer diagnosis is shaped by the degree to which she can turn to her partner and feel support and the ability to process all the big stuff that's going on. The last one I want to share with you was some research from 2007, where these researchers took a sample of women who had a breast cancer diagnosis and symptoms of depression. And one of the interventions they offered them was a couple intervention, where they brought couples in together and taught them healthy relationship skills, helped the husbands, these were all straight couples, helped the husbands learn how to talk with their wives about the cancer. And what they found is that the women with the most severe depression had the greatest benefit from this couple intervention. So this, like, teaching husbands how to go from shut down to engaged, made a huge difference in these women's experiences of depression that accompanied this diagnosis. So the relationship dynamics matter. The relationship dynamics shape the course and the outcome of physical health challenges and of mental health challenges. So all of that just basically reinforces what we know in our bones. The hard stuff is easier when we're not alone in it. And it's hard to be near somebody who's suffering. That is what we know and feel in our bones. And we deeply and profoundly affect each other, which is very tricky, because that is not to say that we are responsible for each other. And you're not responsible for making your partner get better. And your partner is not responsible for your unhappiness. You know what I mean? So we're in a complicated area here where we're trying to be real about the impact in both of these directions, without saying that we're abdicating individual responsibility for our own self-care. So it is truly when you've heard me talk about the golden equation of love, of my stuff plus your stuff equals our stuff, we're looking at all three of those elements. Okay, so let's transition to talking about you. One of the things I found when I was getting ready for this episode was an article from 2024 in a journal called Collegian. And they were looking at just the stories, like how loved ones describe their experiences of living with somebody who had depression. And the big takeaway from this research article was that these loved ones were figuring out what living well looks like. What does it mean to live well with somebody who has depression? And living well didn't mean always being happy. It didn't mean always being positive. It meant figuring out pathways to resilience. It meant bonding with somebody even as they struggled. It meant feeling like mastery over a difficult set of dynamics. And it meant using this experience as an opportunity to grow yourself as a person. The other interesting thing that came out of this study was a reminder that when we're talking about anything that has to do with individual health, physical health, emotional health, it's not an either or. This is something in the research that's called the wellness and illness dialectic, that none of us is actually either well or sick. That's too simplistic of a term, that there's a spectrum from wellness to illness, because somebody who has a diagnosis doesn't have the same manifestation of that diagnosis every single day. Sometimes the depression is really little. Sometimes the depression is really big. And sometimes it makes sense. Like sometimes you can figure out why the depression is smaller on this day than on another day, but sometimes you can't, right? So anybody who's dealing with chronic pain, they may have some hunches why their chronic pain is worse on some days than other days, but sometimes it is just a kind of curious shrug of the shoulders of, I don't know. And I actually can't have total mastery and ability to predict and manage and control the symptoms of this process. But it means that we're again and again invited to see the wellness, even when somebody is ill, right? That we are all always more than our diagnostic label. And so if we view wellness and illness as a dialectic, as a both and, then even the partner with the diagnosis gets to be well. They get to be seen as well and strong and competent. And it also means that when you love somebody with a diagnosis, there's maybe always some amount of grief that hangs out in the background, because the highs aren't as high as they used to be, or the highs aren't as high as you imagine they might be able to be. And you maybe are living with an awareness of, this is a good moment, but good moments may not last, So even in those moments where your partner feels really well to you, you may also hold an awareness of a shadow, right? Of what might happen next or what has been. And so I like that idea of holding on to both the wellness and the illness and not seeing it as an either or kind of absolute. So I validate right up top that it is hard, just on its face, it is hard to have a partner who is struggling. And for your particular partner, that may show up as some moodiness. That may show up as unpredictability. They may be distant. It may take up a lot of the conversations in your home. There is something that is just objectively, no matter what, difficult about that. To love somebody is to have a front row seat to their ebbs and flows. And loving somebody means that there's no world in which you're just like kind of unaffected, however they're going to show up today, I'm going to do me and I'm not going to be affected. That's perfectionistic. That's not going to happen. You are going to be touched and impacted by your partner's mood, by your partner's availability, by your partner's attitude. So that's not the metric of success, like not being affected. That's not the goal. That's not where we're going to get to, because you are a deeply feeling person. You're going to be affected. But I think a good place to start is for me to invite you to explore, what is it for you that is so challenging? Because we could take your partner with their diagnosis or with their job loss or with their troublesome ex. we could take your partner and we could put them with 5 different people. And what's going to be hard for those 5 different people is not exactly the same thing. For one person, it might be the unpredictability, because that reminds them of an early childhood experience where they had a volatile and unpredictable parent. For another person, it might be the feelings of a loss of control, right? That I don't feel like I have control over my home and my surroundings because my partner's mood is a question mark to me. And it's the loss of control that feels really troubling. For another person, it might be feelings of abandonment. When my partner is in bed because they aren't feeling well, what troubles me so much is I feel deeply abandoned. And it reminds me of my father leaving, or it reminds me of the days my mom spent in her bed. So there's something unique to the imprint that this experience makes on you. So we can't just stay at the level of this is hard because it's hard. I want to support you getting to a personalized understanding of what is it for you that makes this dynamic with your struggling partner hard for you. And I want to do that for 2 very specific reasons. The first reason is if you understand more deeply the exact nature of why this troubles you, that leads you more naturally to figuring out some coping tools that will be specifically helpful for you. And second of all, I want you to understand it because I want you to be able to then share it with your partner. I want your partner to understand what it is for you that is difficult about that, which doesn't take away from the fact that this would be difficult for anybody, but it ends up being a compassion opener and an intimacy opener if you can invite your partner to kind of visit your world and be like, listen, this is why for me, I tend to get a little bit controlling around your diagnosis, or this is why I tend to get a little bit withdrawn around your diagnosis. So it invites your partner. It will help you make more sense to your partner. You will be more understandable to your partner in how you react and respond. So the first step is for you to spend some time writing about the feelings. What are the feelings that you have? What are the thoughts that you have about your part? So just like letting yourself free form, write them out. I feel sad. I feel disrespected. I feel out of control. I feel helpless. I feel invisible. Whatever it is for you, the thoughts that you have, this isn't fair to me, that nobody understands this, I'm all alone in this, whatever the thoughts are and the feelings are, kind of get them down on paper and then look at them and see if there are parallels to other experiences that you have had in your life. When else have you felt those feelings? It's what therapists call the remote block operation. What does this remind you of from your past? It lets you know the ways in which that little version of you is getting all stirred up by this experience. And it's very important to understand the upset feelings of that little version of you so that you can offer that little version of you tons and tons of empathy and sympathy and validation. And so that you can remind that little version of you, this is not for you. This is not your business. The empowered, grown up part of me has the ability to support my partner, step away from my partner so I can take care of myself. I can do all that. The adult version of me can do that. You can't do that. Little you can't do that. So by understanding how earlier experiences prime you to feel a particular set of strong feelings, you can then assign those particularly strong feelings to the younger version of you. They make so much sense given what you went through in childhood, given what you went through in adolescence. And then you can take care of that little part of yourself. And then you can say the thing that you always hear me say, That was then, this is now, right? Because this is not an exact repeat of your past because you are not the young person that you once were. And you have different tools and skills available to you. I'm going to talk us through how the family of origin roles paradigm might help us understand this as well. So if you are a perfect one and you are paired with a partner who is distracted by a bunch of drama or a health diagnosis, you may feel like your partner's distraction is a reflection of them not being able to see how hard you're working. And you may do one of two things: double down and try harder, perform, 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 right? Those of us who are perfect ones, our belief is we are loved to the degree that we are performing and excelling. And so if we are feeling unloved because our partner is wrapped up in their symptoms or their challenges, what are we going to do? We're going to double down and try to be even better, try to be the perfect. We're trying to become the image of the perfect caregiver, right? We may feel at kind of a deeper level that their struggle reflects our failure. We must not be so perfect if our partner is struggling. So we might personalize that struggle. If we are a parentified child, we may feel some guilt and some shame that our love and our affirmation, our comfort aren't enough to make them feel better, which of course is going to feel like a redo of childhood because when you were little and you were the parentified child, you couldn't make your parents' problems go away. You couldn't make it different for them. So this might feel like a really painful redo where you have to remind yourself, it was never my job to make my parent feel better, and it cannot be my job now to make my partner feel better, because that's going to be the urge. The knee-jerk urge is going to be, I'm going to love you into feeling better. I'm going to love you into recovery. So that parentified child, if you're a parentified child, you need to quiet that urge to kind of empty yourself of any need that you have so that you can be completely present for them, because you're going to exhaust yourself. And in an intimate relationship, you are going to sow the seeds of resentment. If you were an easy one, you may have an inner conflict here. I mean, this is going to feel, if you're an easy one, this is going to feel very much like more of the same. You know, you felt invisible when you were growing up. And now in the face of your partner being distracted by their challenges, you're going to feel invisible again. And so it's going to feel, here we go again. It's going to feel like it's never about me. There may be some inner conflict where part of you wants to pipe up and say, God damn it, enough already. I need some attention over here. And part of you may feel really like this is slipping on an old familiar pair of shoes, you know, like here we go again. If you were a struggling one, you'll have to see how this plays out for you. I think for a struggling one, if you are accustomed to being the one who's having a hard time, it might feel like a relief and pride worthy that now all eyes are on your partner and you get to try something else out and step into something where you are kind of the hero of the story or the helper of the story. But it also might feel, you might get into a little bit of a suffering Olympics with your partner where you want to make sure that you are talking about the things that are hard for you and the challenges that are happening for you. I could see it going anyway. So just kind of check in. One curious check in with yourself would be, if you look over time, does it seem to be the case that when your partner is doing worse, you also are doing worse? And could that be that if you have primarily identified yourself as the one who needs support, you might be falling a little bit into that pattern of suffering Olympics? And by contrast, if you are noticing that you're mustering up some pretty deep wells of resilience when your partner is struggling, I want you to notice that for yourself and note that. And your partner may not be able to see it, but you deserve to see that and celebrate that and feel proud of that. If you can kind of, you know, dig deep and find some resilience so that you can provide care to your partner, that's incredible. And that may be in contrast to other experiences you've had in your life. And I want you to be noticing that and feeling proud of that. Okay, our peacemaker Well, the peacemaker is probably just in action mode. The peacemaker is used to either providing distraction when there are problems or smoothing things over. So if your partner's problem is job loss or difficulties with an ex, you might be way, way, way all up in that situation, trying to work on the resume and create, a path forward with the ex. And you might be really in fix it mode because that is your go-to. Is if people are suffering, if people are struggling, if people are in conflict, your belief is you've got to be getting right in there and making it different. Be careful here because you may be going so fast, like your kind of decades long pattern of stepping in and over functioning might crowd out your partner's ability to advocate for themselves. So your check-in here is, can I move slowly enough? Can I quiet my urge to act enough that I'm making sure I'm leaving enough space for my partner to be advocating for themselves, asking for what they need, providing some of their own care to themselves? And then finally, for our rebel, what I believe to be true about our rebels is the entire enterprise of becoming a couple is a little bit of a challenge because you grew up standing outside of the system and now you and your partner have created a system. So you may still be kind of easing yourself into this idea of being a we. And when your partner is struggling, that might be kind of a cue to you that I got to pull back. I got to step away. I got to distance myself a little bit. So just be careful of some of the things that you may be doing to cope with the difficulty of this situation. And I would suspect that you may be more likely to reach for some of those like avoidant coping strategies, pulling back, shutting down, stepping away when your partner is struggling because it just feels like too much. Because what it was in your family growing up was you couldn't join in the problems because the problems were too big and you were too small to be effective. So what you might need to remind yourself is, I can stay near my partner because my partner isn't my family. Things are different here. My partner and I have created a relationship where we can work together in a way that wasn't possible when I was growing up. So notice your urge to pull back and counter it with a belief or at least a curiosity about the idea that maybe I can stay near my partner, advocate with my partner, and have a different kind of experience of working together. All right, we did it. We talked about the recursive relational frame to help you make sense of why it's so freaking hard when your partner is struggling and why it feels like your responses matter because, P.S., they do matter. We talked about the internal dynamics, why this might be hard for you. Gave you some avenues, thinking about your own history and what might be getting activated from your past. So next week for part 2 of what to do when your partner is struggling, we're going to be going from the why this is hard for you to the what you can do about it. I'm going to be talking you through the internal steps that you can take to ensure that you remain well in the face of this difficult challenge. And then I'll be taking you through the relational steps that you can work on with your partner to ensure that connection is maintained in your relationship, even as there's a struggle that your partner and, as we saw today, you are going through. So if this episode resonated with you, I want you to consider sharing it with your partner. Or if you maybe have a friend who's going through something like this in their own relationship, you can text them the link to the episode. And remember that we also have links to our Family of Origin Roles series in the show notes. Until next time, be well. Thank you for listening to our show. Our producers are Mary Chan and Katie Paggage of Organized Sound Productions. Our theme music was composed by Slade Warnkin. The show is executive produced by me, Dr. Alexandra Solomon. Do you have a relationship question that you want answered on the show? Visit reimagininglove.com to send in a written or audio question. Questions can be about intimate partnerships, family relationships, friendships, you name it. If you're looking for more love and relationship content, you can find me on Instagram at dr.alexandra.solomon or visit my website, dralexandrasolomon.com, where you'll find my blog as well as the Intimate Relationships 101 e-course based off of the popular class I teach at Northwestern University. Thank you for listening and see you next week here on Reimagining Love.